Hello and welcome to Functional Friday. Welcome to the new year, new season, new time to make some changes in your life. I am Becky Schoenig. I am the co-host of, or I'm actually not the co-host, I'm the host of Functional Friday. I am one of the co-owners of Symbol. Symbol is a healthy lifestyle focused restaurant. We are located in Kirkwood and in Chesterfield, Missouri. We are the restaurant that your doctors are sending you to instead of a pharmacy, and they believe that food is medicine. We are the restaurant to fulfill those needs and keep you on a healthy track. Joining me today is Felicity and Emily, and we are going to talk about how to make babies in the new year. Not how babies are made, but how do we make them if we're questioning whether we can actually conceive or bring one into this world and raise into adulthood and be a good human. So Emily, why don't you start by just introducing yourself? Who are you? What do you do? And what's your background?
Hello, yes, my name is Dr. Emily Hecker. I'm a chiropractic physician who practices functional medicine. So I'm in Baldwin, and my area of focus and who I love working with are women just like you and men who are trying to strive for a baby. One of my specialties that I really love working with is something called MTHFR, which is a gene that really some people have issues with. So genetic issues, inflammation, a ketogenic style I really enjoy doing, anti-inflammatory. So autoimmune, I love it all.
And Felicity, welcome. This is the first time I'm having you on the show. We've talked a little bit. Tell us a little bit about who you are and where your practice is at.
Sure. I'm Dr. Felicity Keough. I'm also a chiropractic physician. My practice is in St. Charles. I've been in practice for about 10 years, and I have a huge passion for helping pregnant women and children. So I work with a lot of families, but in particular, our specialty is dealing in helping moms that are, before they get pregnant, during their pregnancy. So we see a lot of moms that come in with babies that are in less than ideal positions. So helping them with that, or just the regular pain that comes with, I shouldn't say regular, but some of the pain that can come with pregnancy. And we help little ones too after they're born. We're trained and certified to treat, infants, tiny little. So we see infants. I'm also a functional medicine practitioner. I've integrated my practice so I can run blood work and other labs in my practice because I feel as though that's so important. I just want to mention I'm a third generation chiropractor. So my grandfather, he actually graduated, him and my grandmother, they graduated in 1947. And they told me, when they first started their practice, everybody only needed chiropractic. That's all they needed. And they responded. But as his career progressed, and the decades went on, he noticed that chiropractic wasn't enough. So that's when he brought in nutrition and started working on people's diets. And so that's really kind of how I started off, was just knowing that people needed more because our food is terrible and so much toxicity. So, I've integrated my practice to be able to help with functional.
That's fascinating. I think it would be interesting to have a conversation with your grandparents as to how chiropractic care has changed throughout the years. Let's talk a little bit about this new organization that you guys started, Fertile in St. Louis. It's interesting because I remember having conversations, I believe, with both of you maybe a year ago when we first started the Functional Fridays about how you wanted to bring more education to how somebody can naturally conceive when they're having issues. Felicity, can you tell us how Fertile in St. Louis kind of got birthed?
Yeah, absolutely. Actually, I came out to see you, Becky, at one of your events, about 8 months ago. And I just was real eager to share with you my passions for helping women and children and, what we're doing in our office. And that's when you planted some seeds before Fertile in St. Louis existed. That's kind of you were planting some seeds. And then after that, I reached out to Dr. Emily and just kind of told her some of the ideas that I had, and she was real interested. And I reached out to Dr. Emily because she's such a unique provider in the area. I more people need to know about what she's doing, because she's doing some really amazing things with genetics and MTHFR. And I just think, we work well together because we do a lot of this similar stuff, but we do completely different things as well. So anyway, we met, Dr. Emily and I met, and we brainstormed a lot, and we came up with Fertile in St. Louis. And that was probably in September, I think, October, September. And since then, we've put together the Facebook Lives, and we've made the download, and we've created the workshop that we're gonna talk about too.
Emily,
so that's kind of how it got started. Becky, you planted the seeds.
I actually had I remembered meeting you. I remembered having this conversation, but thank you for recognizing me and saying that I helped plant the seed into actions moving forward. And I was detached from it at that point. Emily, tell us a little bit more about this event that you guys have coming up in January, on January 9th. And you guys are also involved. You're collaborating with a few other doctors also in St. Louis. It's not just you guys. It sounds like there's this whole collaboration of you guys coming together to bring education.
Yeah, we are super excited about this because we want to our passion is to educate people, to get people the knowledge that they need to, in our business, is to get a healthy baby and a healthy body. And so we are partnering with Dr. Mike Shainwalder, who is a wonderful integrative practitioner. He's a DO here in St. Louis, and he will be joining us for this workshop. And some of the things that we're going to cover are just common questions that people have in wanting to get pregnant and maintaining a pregnancy. So those are the types of people that we're looking for. If you can't get pregnant, let's see what we can do to optimize your body. And say you can get pregnant, but you can't maintain the pregnancy. That's, we want to address that as well. But some of the key concepts that we're going to be looking at is looking at thyroid hormones, looking at important steps just to make sure your thyroid hormones are ideal for pregnancy. That's a huge component. So Dr. Mike Shainwalder is going to be addressing that piece. He is the thyroid guru here in St. Louis. So we're both excited to have him join us. He's a great friend. We're going to be looking at stress and sleep, because those topics alone can be super, super important for longevity and improving your odds for a healthy pregnancy. And stress, is a central predictor to health and longevity. So we're going to address those pieces. We're going to look at emotional health as well, because I think that's a huge component that you have as well. As, man, I have these things going on, but how do I implement it? There's so many things up here that we need to control with that. So we're going to be working with what can we do for emotional health. We're going to be taking assessments for all of these too. So we're going to give you the tools that you need to actually implement and start these in your life. We're going to be looking at MTHFR and detox, which is one of my favorite things to talk about, with what is MTHFR and what do I do if I have the genes? What supplements should I be taking? Is detox safe in pregnancy? We're going to be covering all of that, as well as structural balance, which is, being chiropractors as we are, is super important for fertility and getting that balance with the pelvis, with the uterus, just controlling the nervous system. So we're also going to be looking at food sensitivities as well, because that's huge when it comes to how do I know if I need a digestive health support, what tests should you do, what are the most common food allergens that impact fertility. So all of those different things are going to be addressed. And the beauty with them is that you're going to walk in as a workshop. And it's funny because we had planned to do this as a conference, like to come in, sit down, and just, it's going to be a big conference, take notes. But the more we thought about it, it's like, who would want to go to that? I want to go to somewhere where you can be one-on-one with all three of us providers. We're going to give you an assessment. We're going to work with this. We can't give you medical advice specifically for your case, but we're going to give you a ton of information that you can do and create and craft your plan of action. So we are so excited to bring this in and to make it more interactive and fun and intimate and personal. So that is, and you're going to get a breakfast too. So it's a half-day workshop, breakfast, gluten-free, dairy-free, that you'll get as well.
Okay, so this is my thing when I talk to doctors. You guys get into all of these technical categories that make no sense to me and probably half the people out there listening. So I'm going to ask you a few questions of scenarios and give me a couple of pointers. So let's say we have a 30-year-old woman, not in a committed relationship, knows she wants to have a child someday, but here she is 30 or getting ready to go into her mid 30s, and she feels like the clock is ticking. Felicity, how would you direct somebody in that scenario as to how to take now, even before they find that partner to have that baby with? How do they start taking action so that once they find that partner, they're not wasting much time?
Well, that's what Dr. Emily and I, what we do. And that's why we developed Fertile in St. Louis, because we're both doing this in our offices every day. We see women that are looking like what you just said. They know that they want a baby, but that hasn't happened yet. And maybe they don't have the relationship yet. But the first step is figuring out, getting to the root of like what's going on with you. And a lot of times, we don't know. We may not have certain symptoms, so we think we're healthy. But symptoms don't really mean, if you don't have any symptoms, that doesn't necessarily mean you are in optimal health. So doing some of the blood work that we offer in our office just to get a really good baseline. It's a very expanded panel. It's picked up by insurances. So that's a really great way for people to get a good baseline. Also visiting Dr. Emily to get a look at genetics, because like me, I have 2 copies of the MTHFR, and that can be really problematic if you're not optimizing your health. So just getting in with a doctor like us, and we're lucky because this area has so many really good functional medicine providers. And you know that, Becky, because you interview them. But going in and visiting with a doctor that's going to look at those things so they can kind of look at what's going on in their health, so they can start making those changes now. For later on, things can be, in a better place.
Emily, if somebody were to do some of this testing out there, are they going to be able to determine how fertile they are, or is it just looking at their health in general? How are you identifying just how fertile somebody might be?
Yeah, I know. I wish you could just plug something into the wall and say, ooh, I'm like 97% fertile. It's so great to do that. And I think that's what a lot of companies are wanting to do, with just saying, here, take this and we'll give you this. But I mean, it's so comprehensive. It's kind of similar to the genetic piece too. So a lot of women or men, will find me and say, hey, I have this gene. This means that I can't have kids. And it's like, no, that's not at all the piece. It's like, we need to make that gene work better. So that's one piece, is to put all these pieces of the puzzle together so you can optimize that function. So it's not just one particular thing, to get, to say, hey, if I do these 3 hormone tests, because I know there's some on the market out there that will tell you, that's just looking at one piece, so you got to look at all of these pieces that we're going to address in the workshop: the stress piece, the hormone piece, the structural piece. I mean, there's maybe some structural inhibitions that your body is not getting. So there's so many pieces that we need to pull together to look at. So one of the goals with this is to help you, guide you, to give you that plan of action with our expertise, with our knowledge of working with women and couples for years to see what we can do to help that.
Oftentimes, I feel like if a woman's not getting pregnant, they're blaming themselves, and it's coming down to them, and it's their responsibility. Let's talk about the low sperm count component. Is this something that is just specifically for women? You need to look at yourself and look at all of the components in your health. Or are we talking to both the man and the woman in this? Emily, can you answer that one?
Yeah, I mean, you got to look at both partners. It takes 2 to make a baby, right? So, so many of this is landed on the female until they realize, wow, I'm doing everything I can, but it's looking at that motility of the sperm and the quality of the sperm, which is tested, especially if people are working with an integrative or just a fertility specialist. That's the beauty of that. What we do can help people who are working with a fertility specialist already It's just adjunct care, or if people are just already just doing this on their own. So the male piece is super important because we got to have healthy sperm to make a healthy baby. So this applies to both men and women, with supporting your body. It's not all for the woman, so man's got to take some responsibility here too. There's a lot of men that are doing this, but a lot of men don't realize, oh yeah, I got to make sure my sperm are good.
Yeah, exactly. Felicity, if there was somebody listening out there right now who has had 4 to 5 miscarriages and their hope of conceiving and carrying one to term, they're losing hope. Is there still hope for somebody like that? And would this workshop be beneficial, or what would you say to that person?
We never can make any guarantees or promises, obviously, but I have patients in my practice that have come in with that exact, scenario, multiple miscarriages, and they've come in and there's been women that have conceived and had healthy pregnancies full term, and others that have not. So it definitely is hard to say for sure, but I mean, I think there's always hope. I think if you haven't looked at your health in the way we're talking about today and putting all these pieces together, if you haven't done that, that's so vital to that hope factor and getting them to that optimized health so they can, have a fair shot. So I definitely think there's hope.
Is there an age that becomes, because we hear these stories where a woman is in her 50s and getting pregnant. Does that mean that she's super fertile, or is there a timeline? Because we hear women talking, oh, I'm on this timeline, and if I don't get pregnant by then, it's not going to happen. Emily, do you find that the timeline is longer than what we perceive it to be, or is it actually shorter, or what is the timeline?
It depends on the person. And, I've worked with women in their late 40s to conceive a healthy baby. And it works. And then you have some women, struggling in their younger years. So it's hard to put that on. You really got to look at the health of the human and see what the ovulation is doing, looking at the cycles. I know Felicity will be talking about that next Friday on our Facebook Live, is how do I know when I ovulate? Knowing your body is the biggest component. Yes, there are issues. There are some things that decrease with health as we age. But as long as we're doing things right, as long as we got, a follicle that's erupting, as long as we have a lot of these other things under control, I don't like to prejudge things, just because of your age. I think God can do really amazing things with our body if we just let it and we eliminate the inflammatory responses.
Emily, how much do you feel the mindset plays a role in the fertility component or getting pregnant? Because you hear stories oftentimes of couples that are trying. And the moment the doctor says, stop trying and just start being okay with where you are, it's almost like instant they get pregnant. How does the mindset play a role in the fertility?
I think it's huge, which is why I like to stay positive when people come in with me, and they're like, oh, I can't have a baby. I don't say you can't, I say when. Let's keep it positive and keep reinforcing that, because that's huge. That's not my area of specialty as a psychologist, psychiatrist, but I know and can identify that is a huge piece. And the more you can decrease that stress, of stress. I just had someone the other day mention that they were pregnant, but they had placenta previa, and she's 20 weeks pregnant. And so she's all worried because she's really concerned about the baby and the uterus. I'm like, you know what? That's something that we gotta be patient with, and I think there's a lot of scaring that goes on, in the medical model, and even going online and Googling things. People get too much access to information now. And so it causes more stress. So plugging, getting away and unplugging, I think is so, so helpful. That's why we need vacations. That's why we need to support our adrenals.
I love the vacation idea. I'm all for another vacation. Felicity, this question's for you. Because of some of the things I was hearing you saying, you're taking the woman or a couple from the fertility component all the way through delivery and treating that newborn baby. What about postpartum depression? Are you guys playing a role? Are you guys just focusing on the fertilization component and getting somebody pregnant, or where does the postpartum component come into play?
So as a prenatal chiropractor, we like almost don't give them an option. You know, we make them like hear the importance of, okay, when your baby's born, as soon as you're up for coming back to our office, we need to get you back in for a postnatal checkup, a postnatal exam, just to make sure that she's getting cared for throughout that 4th trimester, which is so important. And then, of course, helping them, you know, identify, you know, if they are having some postpartum depression, helping them with that, and of course, going to their doctor for that. But yes, like that's a huge piece of it. And we have almost all of our pregnant moms that have their babies come back to us with their babies during that 4th trimester, so they can get cared for and get structurally balanced again. That helps so much with, you know, their well-being and their milk production, and just general mood, and helping them with decreased pain, because pain can also be a trigger for depression. So yeah, I mean, that's a big part of what we do in our office.
Emily, how important does food play a role in the fertility and the carrying of and the growth of that baby inside you, and then into the postpartum? I always have to wrap this into food somehow, you know that.
Got to. I mean, look what you're doing with Symbol. You know, it's huge. And that's what I tell people when they come in and meet with me. You know, I say that the majority of what we do in functional medicine is based with food. It really is. You know, and then it's a smaller piece that I deal with a functional medicine. If you're not able to get good quality foods in that are being digested properly and being absorbed into your body to make those enzymes work to give you the nutrients for your neurotransmitters for your baby to form, then, I mean, you're not going to have a good quality of pregnancy or just health in general. So you got to look at, you know, are you absorbing the foods? You also have to look at the quality of the food. So in your case, Symbol, which I love and recommend to all patients, you know, you got to do an anti-inflammatory diet. You got to eliminate those foods that cause more inflammation. And especially with fertility, we need to reduce inflammation. I mean, that's the deal. We got to eliminate that piece. And eating food that is, you know, anti-inflammatory is one of the biggest pieces. So yeah, you gotta eat right. You gotta have an adequate protein too. That's something that is really important. I had a patient yesterday came in and was struggling with a pregnancy loss. And she was a vegetarian for 2 years and didn't eat protein. And that's when she got pregnant and, you know, unfortunately lost the child. And when you look at the case history of things, you got to look at all pieces of the puzzle to say, you know, the baby is made up of 90% protein, you know, and you got to have adequate protein. You got to have adequate fats, you know, and decrease the sugar component. So diet is so important when you're trying to conceive, maintaining pregnancy, and even going through the postpartum phase and you're trying to produce milk for your child. I struggled with that. You know, with my 2 kids, I have a 5 and a 6 and a 7-year-old, and breastfeeding was tough for me, you know, and I had to get the right amount of foods in, the right amount of water. So super important.
I think that you just hit on a couple of components that I think wind up being we overlook it oftentimes, and that's identifying what works best for you. And that's why having a partner with a doctor is so important, because so many people are sitting back reading the next book, following whatever their latest girlfriend or guru said that they should do. And that one thing that might work for one person may not necessarily work for everybody out there. And that's the value and the importance of identifying what works for you specifically in the partnership with that doctor component. Let's talk about, I know it's kind of going off track on the fertility side, but you brought up breastfeeding and how important it is to get the proper nutrients when breastfeeding. how many moms are you seeing breastfeeding nowadays, and how many are you seeing not breastfeeding? And what is their reasoning behind not breastfeeding versus the other? Go ahead, Emily.
Are you talking?
I know. I'm sorry. I did not. If I don't ask, we won't have anybody talking.
I'll take this for, real quick. And Felicity, you can tell me what you think on that piece. But in my office, I see more natural-minded women, so I'm a little more biased with what's actually going on because the people who come to see me are wanting to do more natural methods. But of the people that I see, in just real life that aren't coming to my office, I think it's convenience who are not doing it. Or like with me, I struggled with it. My first son, I did formula and I felt so guilty doing it because I know it wasn't the best source, but I had to figure something else out with that piece. So I think there's a lot of different reasons why women don't, or they go back to work, or they just don't want to deal with it. So there's so many different reasons, and it's so hard. We get in these natural minded, especially the people, that your audience is, say, breastfeeding is good. We have to only do breastfeeding, but you got to look at reality and say, what, some women just cannot produce it, or they're so stressed they can't release that oxytocin to let down, or they're not getting adequate supplies of B12 and their methylation sucks, so they can't produce it. The interesting fact, cows up in altitude, they give them B12 to produce milk. So it's it's really, when you take a big look at things, there's a lot of different reasons why that lactation goes into play.
Felicity, what are you finding coming into your office? Where are the moms? Is there a struggle? Is there a mindset that one is feeling guilty if they're not breastfeeding, or they've completely made up their mind, this is the only way? What are you seeing coming into your office?
A lot of the same, just because we are like a holistic chiropractic office. We also have a lactation support twice a month. So we have a lot of moms coming in that are needing that help. So, one of our questions during pregnancy is, do you plan to breastfeed? And I've only, I think, maybe had one mom ever tell me no. And I don't know why that was, but most moms, they have that intention where they want to. And then it comes down to it and they don't have the support. They're stressed. Their baby might have a tongue tie, lip tie, all of that. There could be other issues. And then sometimes there's like actual medical reasons, like insufficient glandular tissue, where they just won't ever produce enough milk. So, but I think overall, like our patients anyway, are coming in wanting to do that and looking for that support. And we try to assist them with that. And if we have to refer them out to get their baby's, tongue and lip, taken care of so the baby can latch, then we want to be a resource and help them get what they can so they can breastfeed and just support them as much as we can. But I say overall, more and more people that it seems to me are trying to, to provide that for their babies.
I like sharing some of my own personal stories because I think that it's always valuable to somebody who might be listening. And I don't know what I would choose to do today. I had my kids when I was very, very young. I was very fertile. I had no problem getting pregnant. My daughter was born 9 weeks premature. I was in the hospital for 9 weeks prior. She was 2 pounds, 9 ounces. I tried very hard to breastfeed with her. And as a young mom, my biggest fear was that she just was not gaining enough and getting enough in her. And by bottle feeding her, we were able to see exactly how much she was getting. But I pumped for 9 months. I said I felt like a cow walking around with this pump and going shopping with my mother-in-law, and I'd have to go into a dressing room or something like that. And then on the flip side, my son, when he was born, he was 2 weeks overdue. And I tried breastfeeding and would have had no problem breastfeeding, but I hated. I was one of those moms that I just wanted my body back. I wanted my life back, and I struggled. And there was this huge mental bashing of myself that I wasn't a good enough mom or whatever. And so it's valuable and important, and that if you are a mom watching this and you're struggling, that your happiness and your health needs to be the number one priority. No matter what. Emily, tell us how people can find out more about the January 9th events. And make sure that you put that link into these comments as well. And if you guys have not seen on the symbol page, there is a place for you to post events on one of the comments as well. So make sure, I don't know if you guys are in there or not, but we'll make sure that that link is added to several different places and shared out there. Any last words of wisdom or things people can anticipate if they're interested in the January 9th event?
Yeah, so they can go to the link. If you're watching this video, go to the comment section. You can click on that. If you're not already following us on our Facebook page, go to Fertile in St. Louis. You should see us linked here, you know, on the symbol page. Go there, follow us. We have a document that you can just download now, so you can get news from us. You can get on our list to get in your inbox to give you information of the new stuff. This is just one event. You know, we just started. Who knows what's going to go on in 6 months? You know, so we already got some fun things brewing with us. So so go to there. You can check out if that date doesn't work for you, but you're still interested in the workshop, and you're like, yes, I want to do this, but I'm busy that day. I'm out of town. Let us know. Shoot us a message. We want to hear your feedback. We want to hear what you want to talk about and what your questions are, so we can address that. So, you know, we really are here for you. And we want to know what the key things. And we just pulled this together with some of the questions that we've had, some of the key concepts. If people want to know a little bit about more of one topic, or what one speaker more, or one topic more, we're gonna respond. So we're excited to do this, to bring that out. So if you want to join the workshop, go to the link, or you can go to our we have a website, and the website is linked there, but it's fertilityintensive.enlightenstl.com. They can go there and sign up. It's through Eventbrite. Tickets are $100 per person if you're bringing your spouse, your mom, your best friend. We're going to give you a discount, so it's $175 for 2 people, and we encourage that. I mean, you got to have that support network there. So we're super excited to offer this. We'd love to have you.
But Emily, make sure that you message me or email me the link, so that we can also add you guys as a resource on the symbol page.
Okay.
So, because we get people contacting us all the time asking us for resources, and we just send them to that, to our resource page to find it themselves. Felicity, can you end with why you're so passionate about bringing more babies into this world? Did she just freeze up?
I think she's so excited to bring babies in this world, she froze.
It's like we're all of a sudden playing that that game out there where you go frozen for a short bit of time. Emily, I want to go ahead. We'll go ahead and just finish this up. Make sure that you post in the comments again the links, so that people can find that easily. If you have questions about this, feel free to private message us. I'm happy to send those questions over to Emily or to Felicity as well. Thank you, ladies, for joining me today. This has been fun. I'm glad that the technology kind of came together and Felicity didn't freeze until the very, very end. Thank you again for being such a supporter and influencer in the St. Louis area. Promoting and marketing symbol, food as medicine is our philosophy. It is part of our message is to deliver to helping heal the St. Louis community. I'm Becky Schoenig, one of the co-owners of Symbol. You can find us in Chesterfield and in Kirkwood. We are the food and the restaurant that doctors are sending you to. So we welcome you into 2019. We're looking forward to seeing what the rest of the year brings, and I will talk to you all soon. Thank you.
Thank you.